Hello guys, in this video I just want to talk to you about this Coltazol. It's a temporary fill-in material, but I don't use it for temporary fill-ins. Obviously, being a CDT, this is not something that I do, but what I do use it for is for taking impressions for patients that have got big interdental spaces between their teeth where they've had a lot of recession, and I'm trying to take an accurate impression. So I might use it for alginates with patients that are having temporary dentures where those teeth might be a little bit loose, might be a little bit mobile, and to stop the impressions locking in around those teeth through those interdental spaces. What it does, it stops it locking in between those spaces, and then it will stop the distortion of the tray. When you remove it, it stops the alginate tearing because it's not locking together. Also, that can help when you've got mobile teeth to stop pulling them out, or to stop that discomfort of the patient when you're taking those impressions. So let me show you with this model that I made. So there wasn't recession on this, so I had to just sculpt it to give you an idea. So this is the sort of situation I'm talking about, where there's a large space there between the teeth, and as the material flows in, it just locks in, and then when you try and take the tray out, it gets stuck. It will pull the material out of the tray, and it can distort the impression as well. So it's not good for either silicone or alginate. The tool that I use is Optosculpt, something that we use in the laboratory when we're doing composite build-up and things like that. So it's got a little hole in the end of this one. You get these little pads that push in, are replaceable, and they're quite nice because with this tool in Coltazol, you scoop a little bit up with this end. Quite often I put this bit in with my fingers, sometimes if it's a big bit, and I'll just sort of squish it in like that, and then I'll use this flat edge to just sort of blend it into the teeth. Build it up, squish it in there, so not too much. And if I'm doing a silicone impression, obviously I'm very conscious of, if I'm going to be making a metal frameworks, which I would always do on something like this, I don't want to interfere with where the clasp is going, so I push it in now with the soft end, just pushing it into that gap. And again, it can be a little bit tricky, just making sure that it's not coming out there. So you might put a mouth mirror in just to have a little look, but as you can see, it's not going to affect the inside there. This sort of situation here, if I feel like I might need to get the clasp down into this bit, I can always move it off of one tooth and just build it up on the other, or just scratch it back. By this point, it's usually getting a little bit wet with the saliva, and it starts to set. It tends to go sort of like crispy. That'll hold for just enough time for you to then take the impression. The silicone material won't lock in. If it's alginate, it won't lock in. It will just come out nicely, and you won't get any of the tearing or the stretching, depending on what impression material you're using. I also use it when I'm doing silicone impressions with those interdental spaces. If there's an interproximal space, when I can take the impression out, it will still fit through that gap, and it's fine, then it doesn't distort it. But if there's no interproximal space, but there is an interdental space where the material then flows around that tooth and locks in, then as soon as you try and take that tray out, it will distort. It will stretch the material, and then it will just tear or something like that, or leave little bits wedged in between the patient's teeth. So to prevent that, I just put a little bit of this material in, I smooth it off, you give it a minute, and it sort of sets in the mouth. It goes crumbly, so it doesn't set really hard. After you've taken the impression, it's quite easy just to pick it back out and give the patient a rinse to remove it. And I just find that it works really, really well. So nice little hack for you there for taking better impressions. Hope this helps. If it does, give me a like and subscribe, because obviously that really helps the YouTube algorithms to show this video to more people like you, and it will help me grow the channel, and I'll be able to keep putting more little tips and tricks like this out for you guys. Cheers. See you in the next one.